Hello everyone, how's it going? Do you ever wonder about your forgetfulness? Like, where did I put my glasses? Or what was the name of that place? Do I have dementia? Or am I just forgetful sometimes? That sounds interesting to you? Then keep watching. So what is dementia? It's not a disease, but a group of symptoms caused by other conditions, and it causes decline in mental function that is usually irreversible. It can affect our memory, thinking, and social abilities. Now, the disorder has to be severe enough to interfere with our daily life to be called dementia. So, we all forget where we put our keys sometimes. Sometimes we struggle to find a word, but then we remember it later. Or forget the name of an acquaintance, forget a recent event. But if we're still able to drive normally, prepare our meals, schedule and keep appointments, pay our bills, even though some of these tasks may take us a little longer as we get older, then we don't really have symptoms that are significantly affecting our daily life. Now, some symptoms of dementia we would want to look for are not just memory issues, but other cognitive decline, such as trouble with reasoning, judgment, problem solving, being able to plan and organize. We may even have difficulty with coordination or motor function. We may have confusion, disorientation, problems with visual perception that actually goes beyond typical age-related changes in vision. Now, the growing medical consensus is that irritability, depression, and anxiety are signs of dementia that we see even before we see any difficulties with memory. So because of that, doctors are starting to ask more questions about changes in mood and personality. Now, that can include, besides anxiety and depression, inappropriate behavior, paranoia, agitation, even hallucinations. Now, all of these symptoms actually make sense because something caused damage to or loss of nerve cells and their connection to the brain. So because of this, we could actually get lost in a familiar neighborhood, use unusual words for familiar objects. We could forget the name of a close family or friend. We may not even be able to complete tasks independently anymore, such as being able to prepare our own meals, pay our bills, remember to make it to our appointments. Now, before we go on to those who are at most risk, I'd like to just ask you to please like and subscribe if you're enjoying today's video. I really appreciate that. So those most at risk are those who would be 65 years of age or older. If you have a family history, so you've had a parent or a sibling diagnosed, your race or ethnicity could also put you at greater risk. Older African Americans are twice as likely to receive a diagnosis than white Americans. And Hispanics are 1.5 times more likely to get dementia compared to white Americans. Those with poor heart health, so if you have high blood pressure or high cholesterol, you're more at risk. If you're a smoker, you have an increased risk. If you had a traumatic brain injury or if you have Down syndrome, you have a greater risk. Now, there are some reversible causes. So some people will get symptoms of dementia because of a medication side effect, because of increased pressure on the brain, vitamin deficiency, and even thyroid hormone imbalance. So you definitely would want to check with your doctor because some of these situations and issues could actually be corrected. Now, the most common cause of progressive dementia in older adults is Alzheimer's disease. It's actually estimated to account for 60 to 80% of the cases. Now, in a future video, we'll discuss some of the different types of dementia, and we'll discuss how it's diagnosed and just how to cope with a diagnosis, whether it be that for ourselves or a family member. Have you had a family member or a friend diagnosed with some form of dementia? I'd like to hear about your experience. Please let me know down in the comments below. It has been suggested that adopting multiple healthy lifestyle choices may reduce our risk of cognitive decline and dementia. Check out the link below for more information on that. So memory loss alone doesn't mean someone has dementia, but if you or a loved one are experiencing more cognitive changes and or psychological changes that are interfering with your daily life, be sure to talk with your doctor. Well, I hope you've enjoyed today's video, and I hope to see you in the next video where we'll discuss another way we can improve our health